Really organic.
The organic thing. Everyone's a unique individual.
And you're stripping away all the impurities of the massage, and I call them impurities that have been brought in from outside influences. If we strip away all the impurities and use just what works, and then structure what works to that individual,
Yeah,
it's becoming that organic feel, isn't it?
that's right. It's like having our tools in our tool bag. Having tools in a tool bag doesn't make you a carpenter. It's knowing how to use those tools. So that's why I look at techniques. Oh, this technique where we put the elbow in the hip and we move it like that. This technique where we hold this point and maybe stimulate it. These are all techniques. It's great. The more techniques we know, the better. We understand a technique, we understand this. We put that technique in our tool bag. That doesn't make us a massage therapist, actually. It does, in the simplest sense of the word, you're a very low grade massage therapist, but you're not really an artist. You're not really a high class. Like if you want to have a carpenter, you could have a pretty low class carpenter build a simple house, very simple structures. But if you want an artist to come in and make this place amazing, you get a high quality carpenter, they're an artist. And that's what we're trying to train people to become, as artists. But of course that requires experience and time and all that sort of thing. But what that means is to understand these are techniques. These are like tools, but we need to know how to use them. And that's why I don't teach a routine style massage. And this comes exactly back to what you're saying. It's an organic form of treatment. It's not just a routine. We don't just go through the motions and hope, yeah, even going through a routine massage, yeah, you might hit the spot during your routine, great, but did you do it in the right order? You might get lucky and it really helps a person, but more often than not, yeah, it helped a bit, but it didn't fully organize. Whereas if you're a skilled tradesman, you go, okay, this is what needs to be done, and I'm going to use this technique to do this and that, and then that we've unraveled the tension. But just as with any job, sometimes you encounter difficulties. Sometimes it's a nice simple job, and you just go with that massage, you go, oh, so easy. I just did a few points here, oh my God, they released, and oh, I got them to a point. What an easy job. Fantastic, But other times they aren't like that at all, and you've never encountered a problem. Just as somebody who's an electrician suddenly encounters, well, gosh, somebody had done some really weird wiring in the job 100 years ago that I hadn't seen, and the wiring was over here and over there, and I've never seen this, I have to figure it out. And that's many cases with what we're doing. All these different bands, and it's almost like that in the body. We got electrical, it's like having electrical bands that are all curled up and tangled a bit, and this knot here, and why is this thing held tight? And we're not stressing so much importance on, like, that's the triple warmer, and that's the lung meridian, and that's the gallbladder, and that's the large intestine, small intestine. What we're now stressing is getting back to a more organic form of looking at them as bands of tension, and following them with our fingers. That's right. Learning to feel, not learning to come from just your mind of a mental construct that somebody in China has made, or somebody, because the Thai Sen lines are different than the Chinese acupressure lines. And why are we just adopting acupressure lines and not the Sen lines? Or why are we not adopting the nadis in Ayurvedic medicine, which are the energy channels there? They say there's 40,000 of them. You'd never learn in a lifetime all the nadis. I certainly don't know. But what I do know is I know how to feel. And that's what we're trying to teach people, is we're trying to teach people how to feel. And in the end, it doesn't really that matter unless you're doing some other form of therapy in conjunction with massage, what meridians we're working on. It may, as I say, if you are doing something like herbal medicine and you feel that this person's got a tight liver meridian, and then you can prescribe buplerium or some other Chinese herb that can help release the liver tension. Or you could sit there and prescribe, the person's got some lung things, well, maybe they should stop smoking, or maybe they should have a herb that helps dry out the moisture, so it can help understanding those kind of things when you're using them in conjunction with other forms of therapy. But from our point of view, as a simple massage therapist, or a complicated massage therapist, whichever way you want to view yourself, is that we're really trying to find the tension and get rid of it. And we keep it simple like that. If it's tight, we want to loosen it. But first of all, we want to find out where is the tightness coming from, so we can get it out from its roots. Because not always just rubbing over something that's tight doesn't always loosen it. It's often we got to trace it down to a source, which is usually the tips of the fingers, the tips of the toes, or it's in the head, in the mind, or it's to do with the lack of breathing. And we want to get rid of it. So we like to keep it simple, and keep it simple for people that we're training as well, so they don't get sidetracked. It's one of the reasons I don't teach all these complicated terminology in Latin or Sanskrit or Chinese,
You know, some of the great history, obviously the great languages of the world are Sanskrit, and, you know, is because for most of us in the modern day, it's hard to remember all these things unless you've got some sort of, and it comes down, even if you can remember them, is it that important? It's not. It's not that important. You know, unless you're talking with some, if you want to talk to some Western trained doctor, talk to him in Latin. If you need to talk to some Ayurvedic doctor, okay, maybe you need to talk to him in Sanskrit. Or a Chinese therapist in Beijing that you're trying to talk about, you know, different acupressure lines, maybe you need to discuss the points in Chinese. But if you're not doing that, you don't need to know them. You don't need to know the Sanskrit, the Chinese, the Latin. You just need to know, you need to feel it. So this is why in traditional places, such as Korea, Japan, blind people were traditionally the massage therapists. It's because they have a different world, that sense when you have your eyes closed. What can I feel? Not what can I analyze with my mind, what can I name this, but what do I feel? That's why a lot of good massage schools sometimes get people to do a massage blindfolded. And it's something I actually think is quite a good idea. Or to just close your eyes when you massage, especially when you're looking for fine detail. It's very easy when you're looking at the back and the muscles of the back to feel the tension and all that, the bigger muscles of the body. But oftentimes people have great difficulty feeling the tension in the tips of the fingers, or the toes, or in some of the fine detail of the hands and the feet, or in the face. Usually we don't massage the face with our eyes closed, but you can. Actually, I mean, blind people do facial massage. Once you're more familiar, you're not going to stick your fingers in their eyes or something, but certainly with the hands and the feet, it's a great thing to do, just to close your eyes and not analyze with your mind, but to go, what am I feeling? So it's like you're bringing your awareness out of your mind and into your fingers. And in fact, this is one of the key things about what makes a good massage therapist, is somebody who comes out of their mind and into their hands, into their fingers, or into their elbow if they're using their elbow. Their awareness, their chi, their life force is present there. It also makes a big difference to the person receiving the massage, to feel the presence of the other person there. It gives them confidence, it gives them a surety that you're paying attention to what you're doing. You're focused 100% on what am I feeling. And that also provides that connection between the two people. And that allows a person to relax as well. There's nothing worse than if you're getting a massage and you can feel the person's hands are on you, but they're actually looking out the window. You know, I see sometimes these massage therapists in malls and things like that, you know, and they're calling somebody over, you know, and they're massaging this person, but really they're looking over at them. Their whole awareness is out here, and they're doing this stuff with their hands. I've had that kind of massage. It's virtually ineffective. There's no connection between the people. There's no presence, because all you're doing is going through the motions, but you're not actually paying attention, because a good massage therapist is both diagnosing and treating at the same time. In the sense of diagnosis and treatment, I say is feeling tension and getting rid of it. That's what I mean. I don't mean diagnosing as in naming it in some Western medical term. We don't even worry about that. If somebody comes into me and says, I've got some complicated Western medical term that I've never even heard of before, my whole thing is not about that. My whole thing is, let's see where you're tight and see if we can get rid of it. And then if it's going to help, it'll help. So I have a saying, let's get rid of the tension and then see what's going on.